when I was about 14 years old, I started to have problems, and my mom and I, when I say we, I mean my mom and I, we went to visit several doctors, and unfortunately at my age, no one agreed to operate because I was so young. They said that it was nearly impossible that I would be showing symptoms or signs that early. And when I was 19, February of 2012, I had my first laparoscopic procedure to remove the endometriosis. After the surgery, I started using painkillers pretty heavily. I ended up having to drop out of school because of that. I was in VCU, and when I found out I was having my surgery in February, I decided to take a medical leave of absence. So I did, and it was approved as a medical leave, so I had the option of going back once I went through the healing process. I decided not to start back in fall of that year. I'd kind of spiraled a little out of control with painkillers, and I thought that I could get myself together. In between my first and my second surgery, I was introduced to heroin. And it didn't take long for that to spiral out of control either. It did the same thing as the painkillers. It made me feel the same way. It killed the pain just like the painkillers did, and I didn't have to think about how much pain I was in. In the beginning of 2012, I caught my first possession charge for possession of heroin. Someone had overdosed in my car, and I ended up going to jail for that. A few months after that, I was scheduled to have my second surgery. August of 2013, I had my second surgery for endometriosis. Same doctor that performed the first one. He once again it was very easy to get painkillers from him. He prescribed them for a long time. And this time I was really good at manipulating, and I could tell him, oh, I'm in more pain than I'm actually in. And instead of prescribing the lower dose, he started prescribing higher doses for me more frequently. I ended up getting pregnant at the very end of January, and I had gotten my last prescription right before I found out that I was pregnant. And obviously when I found out I was pregnant, he wasn't going to prescribe me any more painkillers. But it was a miracle for me to get pregnant. They didn't think that I was going to be able to have children, so that was definitely a blessing. I refused to do anything while I was pregnant in the very beginning, and unfortunately, being that I was well on my way, or I was already full-blown heroin addict, I did stop for a few months, and due to the circumstances, I ended up using again during my pregnancy. And that took me a long time to openly admit, because I felt so much guilt and shame about it. But it's something that I've come to terms with. I can't go back in time. I can't take it back. And I'm very blessed to have a very healthy child. And he did not go through any type of issues or withdrawals. And I chalk that all up to God, because I don't know how else that would have happened. In October of 2014, I was required to have a C-section. I was admitted to the hospital to have the C-section, and I stayed for 3 days and was discharged. The next day I was readmitted to the hospital with complications. I had to have another surgery, which led to further prescription of painkillers. And I was on those painkillers for a total of 9 months, which is a long time. It's a very long time. So after that, my addiction really spiraled completely out of control. I went to several different treatment centers, and I could never get it right. I could never get myself together. I ended up getting in trouble with the law again. And I was on probation. I got a violation of probation for failing a drug test. And in September of 2016, I had court for that violation. And by the grace of God, I was released from probation that day, 9 years early. I wasn't supposed to be released until 2025. And the judge released me and looked at me and said, you need to go to treatment, and you need to go far, far away, and you need to stay there until you know that you're going to stay clean. What I think providers could do to help avoiding this would be to fully disclose the risks of taking pain medication. If I were informed back when I was 18, probably would have been a lot more careful than I was, because addiction doesn't run in my family. I am the black sheep. I'm the only one. And I don't know that this necessarily would have been my story had I been given all of the details and had them laid flat out on the table for me, and I knew.
When I was a somewhat young teenager, I developed scoliosis. It was not treated in a timely way. So by the time it finally was treated, with the technology they had back then, it wasn't able to actually be corrected. So they fused my spine with about a 75-degree curve in it. So I always had pain. That helped my pain a lot, but from then on, I always had pain every day. When I was in my early 40s, I developed osteoporosis. That was another battle with the insurance company. They felt that I was too young to have it, so they would not let me get tested, even though I had risk factors. They did not let me get tested until I lost a full 1.5 inches of height. Then they let me get tested, and sure enough, I had osteoporosis. The osteoporosis broke down my previous fusion, so I began having excruciating pain, progressively worse, week by week, so that just walking to the mailbox and back just put me over the edge. It was just horrendous. So I sought out an orthopedic surgeon, but he worked out a plan for me, kind of a drastic surgery, where he would refuse the upper sections of my spine and then fuse all the way down to the sacrum, which is pretty drastic because although that does solve some of the pain issues, that fusion all the way down creates a new pain issue, what I call sit pain, because your spine has to give a little bit when you sit down. If your spine doesn't give it all, then you've got pressure there and it's always going to cause some pain. I was on opioids, originally Percocet, which is oxycodone, for the surgery. They switched me after a while to hydrocodone, which is Vicodin, because that's normal to taper down. And after about 6 weeks, I wanted to get off them because I didn't want to be on opioids for any longer than necessary. I was terrified of becoming addicted. And when I talked to my doctor about it, after trying to taper down unsuccessfully, he just reminded me that pain-free was not the goal, that I was always going to have pain, and I needed to accept that, and accept that I was going to be on pain meds for the rest of my life. I'm on a fairly low dose of Vicodin, and that's by my choice. I'm actually prescribed by the prescription. I'm allowed to take more a day than I do take. It's my choice to keep it as low as I can get by with. I know that I'm never going to be pain-free, but if I can take as low as I can, I think that's just better for my body. With the level that I'm on, I can do the things that I need to do during the day. I can cook dinner for my husband. I can clean my house. I can go grocery shopping. I do have the wonderful blessing of watching my 3-year-old granddaughter most days while her parents work. It's such a blessing, and it's a ray of light in my life. There are some safeguards in place that are appropriate. I get my prescription from one doctor only, and I use one pharmacy only. So I talked to my pharmacist. She told me that I would become tolerant if I didn't take some steps to prevent it. She recommended that I go off it periodically, and that told me that it takes about 5 days to work out of your system. So I choose voluntarily to go off of it about every other month, so that it works its way out of my system, and it kind of kickstarts it. It also proves to me that I'm not addicted to it. For those of us who are using them as prescribed for chronic pain, that's not going to happen. We're not becoming addicted. But to take them away from us, you're leaving us in a situation where we can't function. If one of you guys stepped into my shoes for 5 minutes, you'd be going to your bed. I live with this every day, 24 hours a day. People just don't realize what it's like, and it's very easy to look at somebody like me as a number and not a person who deals with real pain every day. There needs to be a system of weeding out the people who are like me, who are clearly not abusing it from my history, and those who are clearly abusing or possibly abusing. There is a problem, and I need to recognize that. They also need to make it very clear in their letters to their patients that there is a system where they can appeal and be heard. I knew just because of past history, having dealt with some things years ago, that there is kind of a chain of command that you have to work up. And if your appeal is rejected, that's not the end of the story.